Good evening and welcome to today's episode of Marvelous Medicine. The topic is an introduction to aerospace medicine, and as Sarita suggested, we are aiming for the stars. The session was put together by Dr. Shailja Karki, who's not a newcomer to Marvelous Medicine. She's already participated in the session on high altitude medicine. As soon as we finished the session, we had a flurry of messages, and then I just asked, why can't we do a topic? Why can't we do a session on aviation medicine? And she immediately accepted, and then she has put together this program. Inadvertently, I have facilitated a alumni meet of the Indian Institute of Aerospace Medicine in Bangalore. So you should thank me for that, Shailja. Shailja is an officer in the Indian Army. She has been a flight surgeon and is currently in an administrative appointment. She did her MBBS from AFMC Pune and post-graduation from Institute of Aerospace Medicine, Bangalore. After that, she went on to do her postgraduate diploma in hospital and health management and a management development program in organizational behavior. Dr. Shailja has presented her study on gender issues in human engineering and cockpit design at the International Conference on Aerospace Medicine and was part of DGCS Human Factors and Errors classification of aircraft accidents over 20 years in India. Dr. Shailja was involved in the designing of a mobile medical treatment facility and a vehicle-based operating facility for combat in desert area, and also in revising the medical support systems across Israel and Syria during her tenure with the United Nations. Dr. Shailja's hobbies are photography, traveling, off-roading, and her favorite way to de-stress is cooking. Welcome, Shailja, and thank you once again for all the efforts you took to put this thing together. Joining us from New Zealand at an ungodly hour at 3 a.m. is Dr. Sarita Dara. Sarita, I cannot thank you enough for having a sleepless night just to participate in a Marvelous Medicine session. Sarita is a senior medical officer at the Civil Aviation Authority of New Zealand, and she's a space medicine and human factors consultant and occupational medicine physician with Humane Factors Exponential Limited. Sarita did her MBBS from Burhanpur University and as I said before, MD from the Institute of Aerospace Medicine, Bangalore. She has done her master's in space studies from the International Space University at France. She has also got a host of diplomas in Singapore, which include industrial hygiene, occupational health, public health, and she also did her PhD in human factors. Sarita has worked as a physician, educator, and researcher in India, US, Singapore, and New Zealand. She will bring together her whole experience of the past decade or so in today's program. Sarita's hobbies are creating acrylic art and astrophotography. I will introduce Dr. Greg Van from Mayo Clinic, who will be joining us later. He's at his clinic now. And last but not the least is the Sachin Tendulkar, or baby of the team, Dr. Sanjay Purushothaman. He's currently an officer in the Indian Air Force in West Bengal. Sanjay did his MBBS from Coimbatore Medical College and has recently completed his MD again from Institute of Aerospace Medicine, Bangalore. Thank you, Sanjay, for your enthusiasm, and hope you all have a great day. I'll introduce Dr. Greg Van once he joins. Over to you, Shailja.
Good evening, Dr. Vidya, and extremely grateful to you for this opportunity. And yes, I happened to get in touch with Sarita after a real long time just because of this event that you planned. When you asked me to speak about aerospace medicine, I was absolutely overwhelmed because there's such a plethora of information related to this relatively young specialty in medicine. But I promise not to bore the audience with too many details or dates or names. It's not going to be a treatise on aerospace medicine, but generally an overview to what it is and what this practice entails. In fact, the Starry Night by Van Gogh is a personal favorite of mine, and I think it aptly describes man's aspiration to reach out to the skies and the stars. And to quote a quote from Star Trek, to boldly go where no man has gone before. Uh, Flying has, has always been a very romantic notion. In fact, man has not been deterred at all. We have seen so many cases of accidents and fatalities in aviation, but these unfortunate incidents have actually led to an impetus in the development of aviation medicine, as well as the technology in flying. Now we see the evolution of flying machines. Montgolfier, Cayley, and the Wright brothers through their hot air balloon and the glider experimentations, and subsequently to the invention of jet engines and rockets, there has actually been not looking back. And this has led to the establishment of the International Space Station, where people are able to, live for long durations and carry out the various experiments and investigations. We have also moved from the predominantly military and government oriented aviation to commercial, where we now are seeing attempts at commercial space travel and also extreme sports involving high altitudes. In fact, aviation has or flying has become such a daily occurrence that when we take our flight from place A to place B, we hardly give it a second thought to all the the adversities that we are overcoming. We are cocooned in that sealed and well conditioned cabin, and we are unmindful of all the problems or the stresses which are actually existing in the environment and the aircraft related problems. It is, occasionally that when our ear pops due to pressure changes, or we experience a mild nausea or panic attack when we hit an air pocket or air turbulence, that we are reminded of possible potential problems of travel in aviation or through space. Some of us may have encountered a kind of a medical emergency being faced by a passenger on board. And of course, we hear about various aircraft accidents. To say that aviation is actually fraught with a lot of dangers. The higher altitudes that we attain, higher are the risks of pressure changes, hypoxia, thermal stress. In fact, all those conditions have been listed in red in the upper part of the slide. Now, aerospace medicine or aviation medicine is an interesting subject because it has a multidisciplinary approach. Just to name a few, we borrow a lot from physiology, psychology, clinical medicine, occupational medicine, even human engineering and designed to make sure that the flight itself is safe for the not just the passenger, but also the patient and the aircrew. So broadly speaking, we come across two terms. One is aviation medicine and aerospace medicine. Once the flight is in the domain of the Earth's atmosphere, we essentially call it aviation medicine. And once it goes into the realm of space, we would call it aerospace medicine. So in the above part, we have seen that human actually is considered as the weak link, because aircrafts have advanced to a considerable level to take us to considerable altitudes, but man has neither grown wings nor has been there any change in his physiology, irrespective of the number of times he may attempt flying. So there has to be an increasingly complex intervention of medicine and technology so that man can attain this flight safely and return to ground. Not just fly in a safe environment, but at times he may be required to carry out complex tasks. So this is what the interplay of aerospace medicine and technology helps man to achieve. Now, uh, the further away that a man wishes or attempts to travel from the surface of the earth, more complex is the requirement of the supporting technology. Like I mentioned, whether it is the medical aspect or the engineering aspect. For example, a passenger who may be just sitting quietly for the duration of the flight could do with the suboptimal levels of oxygenation, pressurization, or saturation. Whereas an aircrew who is expected to carry out the complex task of flying is expected to be alert and to have extremely good reaction times so that he can carry out this complex task of flying. So he needs to be supported with a better environment while flying. Not just that, even people who indulge in sporting or combat aviation, such as para drop and parachuting, need special survival gear to survive in that extreme altitude. And not just technology, they have a lot of medical inputs in designing of this gear. Like we saw, the jet engines and turboprops and turbofans are getting, the aircrafts are getting more agile and they're getting more fast. So the pilot, the fighter pilot, needs special suits to help him sustain these high G flying efforts. He needs oxygen support system. Not just that, in case the aircraft is incapacitated and he needs to eject out of the aircraft, special ejection seats which are designed. And these ejection seats, other than the engineering technology, have considerable inputs from orthopedics and physiology to make sure that once he ejects, he is not, does not suffer disabilities due to this ejection. As far as the space travel, spacewalk, and astronauts are concerned, I'm sure Dr. Sanjay will be covering it in his topic, so I will not dwell upon that. Now, the interesting part of aerospace medicine is that though the principles of practice remain the same, but its application differs, whether it is in military aviation, civil aviation, or the space environment. In military, these specialists are essentially called the flight surgeons, whereas the civil counterpart would be called aeromedical examiner. And in space setup, we refer to them as a space physician. Since my background is military aviation, that is having been a flight surgeon with the Army, I would like to dwell a little more on the aviation, the military aviation aspect and the role of a flight surgeon in military aviation. Now, essentially, the flight surgeon is very intimately involved in pilot selection and training, and also the medical examination and certification for fitness of the pilot. So this is not just during the induction, but throughout the career of a pilot, he will undergo periodic medical examination to make sure that the pilot is fit to carry out his tasks. Not just that, in case a pilot develops some medical condition due to some acute illness or age-related issues and needs to start some medication, the flight surgeon needs to balance out the potential effect of those medicines or his condition that could lead to any kind of incapacitation while in flight. So he helps to decide whether a pilot can be temporarily grounded or can be given a waiver for flying, or maybe he needs to change his stream. That is, instead of flying the high intensity, high demand fighter to a transport or to a helicopter flying, which is less strenuous and demanding. Other than that, a flight surgeon is called upon to provide expertise and guidance when carrying out patient evacuation by air or in these aircrafts. He may also be required to administer in-flight management or treatment to these patients, depending upon the carrying capacity of aircraft and the condition of the patient, of course. Now, in case of an unfortunate incident of an accident, a flight surgeon forms an important member of this investigating team. So he will go into the possible human factors which could have led to this incapacitation or accident, and accordingly make recommendations for remedial measures. Now, in aviation medicine, there is considerable scope for research and development. The involvement of a flight surgeon is not just with the health of the pilot, but also his clothing, his survival gear, survival rations, the cockpit design, the workloads. I mean, just name it and it is there. And this ongoing development is what is making flying more and more safe for the aircrew and passengers, and making it more amenable to flying, safe flying. Now, like I mentioned, that aviation is a very unforgiving environment. Any kind of laxity in discipline or any health issues can lead to drastic and unfortunate incidents. Therefore, we have very strict policy and regulations. In fact, these policy and regulations are maybe specific to different kinds of aircrafts, and also to the base from which they are flying, depending, for example, they may be flying from the deserts, they'll have their one set of policies and regulations. And if you're flying from the northeast area or high altitude areas, so these are all specific to the aircraft and the terrain in which they are flying. Now, how did I go on to become a flight surgeon? When I was young, I was presented with a book. My brother Yuri, he was the first Russian cosmonaut, and simultaneously one American TV serial called The Medical Center was being aired. So this medicine and space, I found it very attractive. And not to mention the fact that my fascination with military life, travel and adventure, because my father was also from the army. So I found a good combination in doing medicine from AFMC and subsequently aviation medicine from Institute of Aerospace Medicine, as Dr. Vidya had already brought out in the introductory part. Also, what was the final or the decisive factor was the flying experience that you're expected to undertake as a flight surgeon. Unless you get into the aircraft or the cockpit or carry out simulator-based flying, you will never know the kind of stressors that a pilot undergoes. And only then you will be more sympathetic and more educated to design policies or waivers for the pilots. How does a day in my life look like when I was with the aviation squadron? I was expected to wear multiple hats. The primary task, though, remained ascertaining fitness of air crew for flying and education. Education, for example, you needed to inform the pilots about the early symptoms of hypoxia. So where he immediately needs to hand over the controls to his co-pilot, check his oxygen systems, and so on and so forth. Other than that, flying bases usually have a lot of non-flyers and families. So you act as a GP and take care of their medical needs. Then I would be expected to go around the aviation base and the residential complexes, looking at the hygiene and sanitation and the preventive medical aspects. At times, I would also be required to act as a counselor in case of marital discord or behavior related issues in children, and ensure that they got timely professional intervention was available to them by persons especially trained in these areas. Training of medics and non-medics did take a large part of my time, so that this kind of ensured that everybody was geared up to face any kind of emergency, either on base or off base, or even in a combat scenario. Now, combat medical cover, usually the aviation base is in a particular location, and in case of an operation or war, they are expected to fly to another location. So a lot of exercise or trials are carried out, and they move from one location to your operational area. So at that time, you are required to move with them and provide medical cover in this combat scenario. There we also practice carrying out evacuation of patients under combat operations. Now, military CASEVAC, we carry out a number of them, in fact, multiple on a particular day, because as you're aware that military is deployed in, rather forward and remote areas. So evacuation by air is fastest and better means of providing, higher level of medical care as opposed to transportation of patients by road. However, I've been very fortunate. I have not had any accident in base, so I have not been part of any accident investigation per se. But I have been involved in a lot of situations like flood and earthquake, and tourists getting stranded in remote areas where we have to fly in and provide either logistic support supplies or evacuate people who have been stranded over there. So you look after their psychology and provide the immediate first aid. And another interesting part of my tenure as aviation specialist or flight surgeon has been the opportunity that I've had for flying in various Army and Air Force aircrafts. And I always, took my camera up so I could do some kind of aerial photography. And some of the photography also had some official requirements. So that was almost like a highlight of my career. With this, I come to the end of my presentation, and I would now like to invite Dr. Sarita. Like Dr. Vidya has already read out her resume, an extremely accomplished and educated doctor dealing with right from early days of her pilot training in Singapore to her specialist career now. So I now hand you over to Dr. Sarita. Thank you.
Thank you, Shailaja. Just try and get my screen and presentation organized. You're able to see my screen? Just give me a thumbs up if you can.
You need to just go on full screen slideshow.
Yeah. Are you able to see now?
Yeah, perfect.
All right, awesome. So thank you very much. I think firstly for this opportunity, Dr. Vidya, for inviting me to this forum and to give me a chance to speak to everybody about aerospace medicine, which I'm very passionate about. And I'm also very thankful to Shailaja for getting in touch with me after a really long time, and I'm really grateful to be here as part of a panel with her, and it's really an honor to be part of this forum. I'd also like to acknowledge the audience that has come here today, all the friends of Marvelous Medicine, as well as I have my family, so hello everybody. And also my friends. It's 3:30 a.m. In New Zealand, and this is the 18th of November here. We are 7.5 hours ahead of the Indian time. So I just wanted to show our Earth at night. You know, if you see this moving image, you can actually see how even though we are separated by distance, we are actually connected virtually like today. And in where the video ends now here, you will see India right here, and New Zealand is really dark and it's not even visible, because at night you know, this is the lights, this is basically showing the city lights and light pollution on Earth. And this is an example of how aerospace technology has been used to influence or inform life on Earth. So I'm just going to showcase some examples along the way, and hopefully it brings to attention the wide spectrum of the field as we talk about it. So this is New Zealand, and I am in the central part of the New Zealand. So there are two islands, North and South Island, and as you can see, based on the light map, the South Island is relatively dark. And one of the great things about that is that because there's no light pollution, you can see the skies very, very beautifully here. And New Zealand is, you know, the best place to see the skies, the Milky Way, and particularly it's a dark sky reserve. And that is how I have got interested in astronomy as well. And even in my backyard, you could actually pretty much go out and look up in the sky and you can see the Milky Way here. So throughout this presentation, I will be talking about my experiences. So the contents are primarily in my personal capacity, and they do not represent the views of the organizations that I work for. I also would like to acknowledge the sources of the images that I've used. As far as possible, I've tried to use my own images. The picture here is a flying telescope. It's a 747 converted to a telescope. Comes to Christchurch in New Zealand, and was just recently retired from active flying. It's a NASA aircraft. There's a telescope on board, and it does infrared astronomy. And I had the great privilege of visiting this aircraft. So it's, you know, basically a culmination of aerospace medicine, aviation medicine, aviation, astronomy, and everything else. So it was like a dream come true to actually visit this aircraft. So today, I think I'll focus on the civil side of aerospace medicine, though, you know, Shelja has already covered military aviation medicine. I work in civil aviation medicine, but I'm interested in space medicine, and aviation and space is a continuum. So I'll be talking about aerospace medicine in the context of the civilian realm. And just to give you an overview, if we step back and you look at you know, where we are on the planet Earth, which is the third rock from the sun. And pretty much in the entire solar system, we are the only place, or the Earth is the only place which sustains life. And this infographic basically showcases how humans have explored our solar system. We have even gone beyond with the voyagers. And the only place that we have set foot on beyond Earth is the moon. And just yesterday, we've again set into motion the Artemis mission, which basically takes man back to the moon. not just man. I mean, I should say humans back to the moon. It's expected to be the first woman and the first person of color to be landing on the moon if the mission goes as planned in the next couple of years. So what makes us so special? And I think the reason why life is sustained on Earth is, a variety of ingredients. And I believe Shailaja covered a little bit about that, but I just wanted to showcase this image where we have the Earth, and then beyond the Earth, we have this thin layer of atmosphere, which basically is the place where aviators or aerospace activities happen. This airspace, this atmosphere has several characteristics that sustains life, and one of the key characteristics is, of course, the presence of oxygen. But also it helps maintain, support life in terms of the pressure environment as well as the temperature environment. And of course, gravity, which enables us to do things as terrestrial beings in a certain way. Now, why is all of that important? Because the moment we leave the confines of the Earth and we move into the aerospace realm, there are certain changes that happen to the human body in terms of, changes to pressure. And when the pressure changes, the partial pressure of oxygen changes. As we go higher, the temperature changes, and the profile of the temperature changes as we go higher and higher. As we go higher, the density changes. That influences how pressure and volume are interacting. And a lot of aviation or commercial aerospace activities in the lower Earth atmosphere, which is the troposphere. But we do now have activities which is in the stratosphere and even beyond. And so far, we've had 29 citizen astronauts who have actually flown into space. They're not part of any government, but they are private citizens. We do know in the last couple of years, there are companies which have taken people up into the suborbital flights, which is just about 100 kilometers above the surface of the Earth. And all of these activities typically happen within the sphere of the atmosphere. Beyond that, where we have gone beyond 100 kilometers, that's how space is defined. I think we really have not had too much in terms of commercial space activities, but mostly international government-sponsored space activities like the International Space Station, which is present, and in terms of the human presence up there. So just wanted to spend a little bit of time to share that the place of work for the aviation medicine specialist is the atmosphere. And, we are also not to confine ourselves to the atmosphere, beyond the atmosphere. And a lot of our work also is terrestrial. Anything that supports flight operations and space operations on the terrestrial realm, and I'll talk about who they are, the people that they are also covered within the commercial aerospace activities. So it's a very broad clinical discipline, and it basically covers a very wide spectrum of aerospace activities. It's not just commercial aviation as we know it in terms of private flying, but also, search and rescue. We also have private flying, general aviation, where people just fly for fun. They have small aircrafts. We have people who do para jumps or certain sports, adventure sport activities, and so on. And so the spectrum of the humans engaged in aerospace activities is quite wide. But it's not just for the aviators, like I said, it's not just those who fly. Aviation activities is highly regulated, and I'll talk about that. And the reason for that is because of the impact that an aviation accident might have in terms of public safety. When you have a news event of a fatal accident, that it's really something that is not tolerated by public. So there are very high safety standards within aviation and a very high amount of safety culture, and there's a lot of regulation. So the people who are not just the aviators, but the people on the ground who support flight activities are your air traffic controllers, who are also regulated. They need to meet certain medical standards, just almost as equivalent to commercial pilots in order to be able to deliver their work. We also have slightly lesser standards in terms of fitness for duties for flight engineers and cabin crew, but the pressures remain the same for them because they also go into the flight environment and support commercial aviation activities. Emerging technology where we have autonomous vehicles or vehicles which are pilotless are also something of a concern, because truly we don't have something where the human is not in the loop. Somebody is controlling the aircraft, for example, a drone or a remote pilot of autonomous vehicles. So these people are basically also going to be covered within the commercial aerospace activities, mainly to mitigate third-party risk, so that people who are operating these expensive and a piece of machinery, or a sophisticated machinery, they basically are safe to do so and they are fit to do so. And this minimizes the risk of any accidents or events that could happen. The other group are the aeromedical transport and retrieval teams, and I think Shelja covered that in the military context, and I guess that's a very big role in terms of support for disaster relief or any search and rescue kind of operations. Similarly, in aviation, commercial aviation, the emergency crews, aeromedical transport and retrieval team is also a very, very important role. So you do have people like the medical teams, the paramedics, who are trained to fly and who need to meet certain standards in order to be able to deliver their duties. So in a very simple Venn diagram, I just want to showcase that in aerospace medicine, we look at the human being, not in isolation, but in the context of the aircraft, which is the machine, and also the environment where they operate, which is the flight environment. And I think we just cover a little bit about the flight environment and the characteristics of that in the Earth's atmosphere. And that environment changes as a continuum as we go beyond from the, the low atmosphere to lower the atmosphere, beyond to the space environment. So aerospace physiology traditionally is known as a field where we are focused on a normal human body in an abnormal flight environment. This is a very simplistic definition, but basically it's different. So aerospace medicine or aerospace physiology, as we know, is different from conventional traditional medicine in the way that in normal medicine, we look at human body with illness and we manage that, and that's on the terrestrial environment. But in aerospace physiology, we are looking at even a normal human being. When they're subjected to the abnormal flight environment, they end up having certain problems. And those problems are things that could be managed with certain interventions. And I think Shell just spoke about some of those, pressure environment like hypoxia, we can manage with, supplemental oxygen. If there are high G forces, we can do certain things about the G forces like anti-G suits in the military environment and so on. So the next big chunk is the clinical aerospace medicine, where that's a lot of the bulk of the work that I do, is where we're dealing with unwell or unwell human in an abnormal flight environment. I try to use the same sort of a framework to try and describe it. But basically it is the clinical part of the, so you have an individual who is not able to perform well. So we need to make sure that when they are in the abnormal flight environment, how can they be functioning safely? So at what point they can return to flying. And I think that fitness for return to flight following an illness or injury is the crux of the clinical aerospace medicine. There are medical standards, and we try and stick by those standards and ensure that when we certify somebody as fit for flying, that doesn't impact the overall flight safety. A huge chunk of clinical aerospace medicine and aerospace medicine physiology is also in context of occupational and environmental medicine, like how do humans work? And this is not just work in the flight environment, but just everywhere. I mean, so for example, air traffic controllers, working on the terrestrial environment. So they would traditionally would not be the flight environment, but they would be covered under the occupational environmental medicine. So in many countries, aviation medicine is a subspecialty of occupational and environmental medicine. So people learn occupational environmental medicine and then specialize specifically in aerospace medicine, which is particularly for those who are flying. The other area of work is the human factors engineering, which is basically human-centric work, everything to do with humans. How do they think? How do they perform physically? So the physical aspects of the work, as well as the cognitive aspects of the work, and work in extreme environments. And aviation environment or aerospace environment is an extreme environment. So human factors engineering looks at the optimization of the human being in the context of the machine and the environment and how they can perform well. So there's a lot of things here, even though it looks like a simple slide, but there are a lot of aspects to look at. And as Shailaja has already mentioned, the human being is the weakest link in the entire realm. So we do have technology which can take us beyond the confines of the Earth's atmosphere, but it is the human being that sort of limits everything that we are able to perform. So aerospace medicine or aerospace physiology is also about how can we enable human beings to perform optimally in the flight environment. So the multi-dimensional view of aerospace medicine, I bring this out from a paper that specifically talks about space medicine, but I think this really summarizes the Venn diagram in three-dimensional aspect. So you could see that, in addition to the clinical aspects, the human factors aspects of how we can optimize human being with the environment and the machine, the human performance aspects, we also look at the whole spectrum of the individual, the vehicle, the environment, the mission, and the interactions between the whole set of. So this is the more complex model, but this is probably reflective of the complexity of the aerospace environment as well. So it's not pure medicine, and that's the most exciting part of it. It's medicine, but also engineering, but also human performance, but also psychology and everything else. And that is what makes it a very special and unique field. I want to talk a little bit about human factors engineering and what it is. It's also known as human factors, but a very simplistic model is the shell model, where the individual, the human being, the pilot, it could be air traffic controller, or the person around whom we design is at the center, is the central liveware. That person is supported by the hardware, which in the aviation environment is the aircraft. That person also interacts with another liveware, which is a co-pilot, for example, in an aircraft. That person also interacts with the environment. So he takes his aircraft into the flight environment, so he's flying, and then also interacts with the software. So for example, the policies, the procedures that support the organ. So there's a very simplistic model of how human factors engineering comes into play. So it's not just the fitness for flying for the individual at the center, but how they can interact and perform optimally with all the other things that are happening with them. Now, I just wanted to talk a little bit about this life beyond Earth. So when we go beyond Earth, and we do know that the International Space Station is a permanent habitat built in 1998, in the year that I actually started my aviation medicine journey, and has a continued human presence since the 2000s, so nearly 22 years now. And this is the 9th space station that has been inhabited by the crew. So prior to 2000, there were other space stations, and they, eventually were decommissioned, and they, came out of orbit, deorbited. We have, in addition to this International Space Station, the Taigong Space Station. The reason I put this up here is because we have actually taken the Earth's atmosphere up into space. So the International Space Station is pressurized to 1 atmosphere. Of course, we have weightlessness, but we do actually have everything else like in the Earth. And that is why when the crews are floating around in the space station, 400 kilometers above the surface of the Earth, they are pressurized to 1 atmosphere, like on the Earth. So they don't have to, worry about, oxygen supplementation and things like that. But it's just a thin metal that is separating the individuals from the external harsh space environment. Should there be depressurization or any problem, that's all that they have, in terms of survivability. It is a really big challenge. So you would have seen movies and stuff like that. Now, I also want to showcase this picture. This rendition of an actual astronaut who, Bruce McCandless, who actually was using a manned maneuvering unit untethered, and he was, testing that spacesuit and the maneuvering unit. And I have, sort of drawn that picture. But what I wanted to showcase was that his spacesuit is a personalized environmental, support system. Again, the spacesuit is pressurized to close. It's not 14.7 psi and 1 atmosphere, but it's almost enough to enable them to sustain life for the duration that they are outside. So without that spacesuit, the thin layer of clothing, they would not be able to survive. Commercial space operations is something that's going to happen. It's already happening. We have 29 citizen astronauts who have flown in the last couple of years. And we have several companies that are actually doing space operations. New Zealand is on board as well. We have several space technologies that are being tested, and including an autonomous plane that will be pilotless, which will take people up to suborbital flights and come back. So those are things that are happening right now at this point in time, and it's really an exciting field. So we will look at this in terms of participation being more in terms of space activities, with the access to space increased to people who are not necessarily the perfect health. We've had the oldest person to go into space. It was a woman in recent times as a private citizen. She was a pilot, but eventually she also got an opportunity to fly in space. So there's a huge work in terms of how we can enable everybody to have access to space and have a wonderful experience, to experience the weightless environment, as well as to look at the Earth from an overview point, vantage point. So in addition to weightlessness, I think there's a whole spectrum of things that happen with spaceflight, and I'm sure Sanjay will cover those in detail. But when we look at commercial space operations, we are basically looking at short duration flights, not long duration. So people just go up, enjoy the space flight, so they will experience weightlessness, and then they'll come back onto Earth. And we really need to look at how we can develop standards and enable that safely without any harm to those who are actually doing that. So that's one of the areas of work that I hope to be involved in the future. So beyond low Earth orbit, if you're going beyond the Earth's atmosphere, going beyond, like, for example, we want to go to the moon and the Mars, we also need to think about the whole spectrum of activities that will lead to, and what challenges we might have. This is a picture of the Earth and the moon taken by the Mars Reconnaissance Orbiter when you're looking from Mars back to the Earth and the moon. And that's how far we are. And if people go on to Mars, there will be transition of the gravity fields and 1/3 of the Earth's gravity. But of course, they'll be transiting through a low gravity or zero weightless environments prior to going to Mars. So how does that transition affect the physiology of the body is something that is challenging to understand and to have a solution to. The other thing is isolation, confinement, the psychological hazard, the distance from the Earth, and should there be an emergency, how would we handle those? And people will travel in a closed environment in a spaceship to for long distances, and of course the effects of space radiation. So these are all these challenges which need to be addressed before we can safely take people, at least from a commercial point of view, out into beyond the low Earth orbit. I just want to also touch upon this aspect of planetary health. We talk about public health, and I'm sure all of you are familiar with public health as it applies to us. We've just been through a pandemic and still are. And we all know about public health, global health, as it applies to human beings. One health is a concept where we are looking at all living beings. It's humans, animals, as one unit. And planetary health is all living and non-living beings. And I think aerospace provides, or technology, and I just don't say medicine, but aerospace life sciences provides a vantage point for us to look back onto our own planetary health and how we can influence that. One example that I showcased earlier in the slides is the light pollution part of it, and how we can see that from a higher vantage point. But a lot of the things, even the Zoom that we have right now, geographically we are at great distances, but that I'm able to be present with you in this time and place is possible because of satellite communications. And some of the things that we use in space medicine have applications on Earth. For example, telehealth, telemedicine, and we've seen that in great demand and usefulness in the recent COVID pandemic. The other issue is, of course, disaster response management, weather monitoring, and so on. And there's a whole spectrum of aerospace life sciences that are involved as well. So that's a little bit broader, but all of that is part of the aerospace technology as well. So coming back to the civilian aerospace medicine, and I think this pretty much covers what Shailaja has covered. So a large chunk of work that I do in my role is in medical certification, mainly for the pilots, air crew, air traffic controllers. Not so much for private citizen astronauts, but that's something that I hope that will happen in the future. The other areas of work that the civilian aerospace medicine, the aviation medical examiners deal with, occupational health and wellness, mental health, alcohol and drugs, and of course the whole spectrum of other things, including the human factors like the accident investigation and so on. If you look at the spectrum of work, it could be purely clinical, depending on where you're working, or it could be research, regulation, making policy, education, or simulation, so the entire spectrum. And I've been fortunate in my career, spanning over 2 decades nearly, to have had the chance to work in both military and civil aviation as a civilian, and my work in Singapore Aeromedical Center, and also doing the spectrum of activity across the clinical to the research, education, and simulation. So aviation is a safety critical industry, aerospace, as you would say, and it's highly regulated. I just wanted to touch on the regulations very briefly because this is what makes aviation, the way we call it, like safe and consistency in standards across the world. So the International Civil Aviation Organization sets certain standards and recommendations for how we have a certain level of flight safety that we accept. Countries can be signatory to the ICAO standards, and there are 193 countries who sign up to these ICAO standards, and then those countries have their own national regulatory bodies and central medical unit. For India, it would be the DGCA, and for New Zealand, it's the Civil Aviation Authority of New Zealand, where I work. For the US, it's the FAA, Federal Aviation Administration. They set up the national regulatory medical standards for flight safety, and we have a global, some countries have local only, but New Zealand has international aviation medical examiners who actually can do medicals across the world and send their medical assessments to New Zealand. Likewise, space is also highly regulated in terms of the impact it has on flight safety. Internationally, the Committee on Peaceful Uses of Outer Space regulates space activities, and there are all sorts of agreements and treaties on how we should be functioning as humans when we go into outer space. There are national regulatory bodies, and I'm sure all of you know about NASA in India, and in ISRO is the national body, and likewise in different countries they have their own national bodies, like Europe has European Space Agency. And the medical support, again, that framework depends. So right now it's highly dependent on the government involvement, and space is not, commercial space activity is not widespread. So we really don't have much at this point in time. So the aviation medical examiners could probably be upskilled to support space activities in the future. So to sum up, I think this is my own definition. I don't think this is there in any textbook, but basically aerospace medicine physician or a flight surgeon is an interdisciplinary specialist generalist. Because they do have to know a lot of things across a wide range of fields: human physiology, human performance in terrestrial environments, physics and physical science, because how the human body deals in the environment. We need to know about the psychology, the human factors, public health and impact of aviation. We know on public health as well. With the recent pandemic, I think that was a good example. And occupational environment medicine, and of course, clinical medicine. So that's the whole spectrum of work. And I probably would have missed something here, but I guess the main issue is that aerospace medicine physicians enable the health, safety, well-being, and human performance on and beyond the terrestrial confines of the Earth. And that's just also put up as a Jack or Jill of many trades, and master of just some. So that's my city, Wellington. It's also a windy city, so you see that some of the alphabets are pretty much flying off there. And I'd also like to acknowledge, people who have been involved in my career journey throughout, from the time that I started in the Institute of Aerospace Medicine and worked through over the past 2 decades. So this is just an acknowledgement to all the institutes that I'm an alumnus of, as well as the individuals who have supported me, and of course my family. I want to finish off with this slide just to acknowledge New Zealand as well for the opportunities that it's given me. And I think what you see here is New Zealand in its form, the mountains and the clouds. And it's also known as the land of the long white cloud. And of course the sheep, the beautiful landscapes and the sheep. The sheep, basically, New Zealand is known for its merino wool and sheep. So we also know it's a country of 5 million people. And I leave you with a question for you to ponder: how many sheep in New Zealand? And thank you for your attention. And I hope that I could have, I could bring to fore the multidimensional aspects of aerospace medicine as we practice in the civil world. Thank you for the opportunity.
Thank you so much, Sarita. And nobody will believe that it's 3 o'clock in the morning for you. Thank you so much. And due to unavoidable reasons, Dr. Greg Van won't be joining us. So Shailja, maybe we can go on with Sanjay now.
Yes, Dr. Sanjay, can you just elucidate your topic, that is space, for us today?
Yes, ma'am. Shall I start?
Yes, please.
Yes. Is my screen visible, ma'am?
Yeah, you need to just go on slideshow, full screen.
I have put it in full screen, ma'am.
Just click on slideshow, please.
Slideshow.
Yeah, that one.
Okay, ma'am.
Not yet on my screen. Or you want to go on top and use the slideshow on the top ribbon?
Just slide your arrow towards the left of the screen. You will see slideshow there.
On
No, I
top.
have clicked the slideshow, ma'am. It's a slideshow on my screen.
Okay, never mind. You carry on. Maybe the connection is slow or something. Go on. No worries.
You should go back and select the share screen again, Dr. Sanjay.
Yes, yes.
You go back and come back again.
Yeah.
You can stop sharing your screen and then again start sharing your screen. Yeah.
Now, ma'am?
It's not happening. I just try once on top, the top of your screen, the slideshow is there, right? On your PPT thing. Instead of using the symbol, try to click on slideshow once, otherwise just go ahead. Not a problem. Yeah, I think something's happening now.
Is it working, ma'am?
Not yet.
Not yet? Okay,
No.
ma'am. So,
if
shall I?
you're able to change the slide, go ahead, no problem.
Okay, ma'am.
Yeah.
Good evening, everyone. First of all, I'd like to thank Dr. Vidya Mohan Ram for giving me this opportunity. I hope you don't regret it. I'd also like to say that it's been a great privilege listening to two senior members of the aerospace medicine fraternity. I've learned a lot today in this 1 hour. Today, my topic will be a peek into space medicine. So what I will cover is a brief timeline of events which has shaped our exploration into space. Also, what exactly do we mean by space? Like, what is the environment that the human or the astronaut is being exposed to? And what are the physiological changes brought about by that environment on the human body and the countermeasures that have been employed in routine space flight? So if you can see this slide now, ma'am, introduction.
Still on your first slide.
Still on my first introduction, right? Can you see?
No, just the peek into space medicine.
Okay.
Maybe you can close your file and open it again. Close your PPT and open it again. So, Dr. Shelja, if you could address some of the comments in the or any messages to you while Sanjay gets ready.
Yes. So there was this question regarding the aviation medicine. IAM is running short courses for doctors in other specialties, so they can find out from IAM their website, and there you can undergo this indoctrination to aviation medicine, and subsequently on certification from DGCA, you can also carry out certification for the pilots. Sanjay, are you okay with the presentation? Can we proceed?
Can you see my screen, ma'am?
We can see the screen. Can you click on the second slide, introduction?
I am on the second slide. You can't see it, ma'am.
No. We are still seeing the first slide.
Yeah, we can see low Earth orbit.
So
maybe you inadvertently no. Just try full screen now. Just try to go on full screen now.
Now can you see introduction slide, ma'am?
Yeah, we can see the slide, but not full screen. But that's okay. I think you can just go ahead. Since the slides are changing, you just go ahead.
Okay, ma'am. So I'll start with the introduction. Are you seeing the introduction slide now?
Rationale for space exploration.
So why do we travel to space? Why are human beings fascinated by space? Why is it that so many missions have taken place? Why is it that we are concerned so much with space medicine? So the rationale for traveling to space has been scientific research. It has been a matter of national prestige, especially during the space war of the 60s and the 70s between the USSR and the USA. Also, future survival of humanity has been a concern recently. Military and strategic advantages, uniting different nations in the form of the International Space Station, and more recently, and one which makes sense, because you can. As we have seen recently with SpaceX and Jeff Bezos and Richard Branson, if you have enough money and if you want to do it, you can do it. Now, coming to the timeline of events which have shaped our exploration into space, 1610 was the year when the first telescopic observation of the night sky was done at the Republic of Venice. In 1840 was the first clear telescopic photograph of another world, the moon, in the USA. In 1861, a book called A Journey Through Space was written in the UK.
Slides are not changing.
Slides are not changing, sir.
Yeah, now it's changed. Now it's changed.
Now we are able to see the timeline slide.
Yes.
Okay. A Journey Through Space. In 1903, the exploration of cosmic space by means of reaction devices was undertaken by Russia. In 1944 was the invention of the V2 rocket by the Nazi Germany. Now, this is important because the V2 rocket, though invented by the Nazis, was ultimately used for the first space flight. Now, for those of you who are concerned, you can have a quick Wikipedia search about Operation Paperclip, where most of the scientists of Nazi Germany were employed later either by the USSR or by the USA. Now, coming to the first animals in space. The first animal in space was a fruit fly in 1947. First dogs in space were in 1951. The Luna one, the first firing of rocket into orbit around the Earth.
Again, you need to change your slide, Sanjay. It's still stuck on first timeline.
Now, ma'am?
Yes.
It's changing?
Yes, we can see the first animal in space. Yes.
Okay. And in 1959 was Luna 3, which had the first photos of the far side of the moon. Now, is it going to the next slide, ma'am?
Yes.
Okay. Now coming to the more interesting part, the first human space flight was in the year 1961 by the USSR. The cosmonaut, was Yuri Gagarin. The first American astronaut to go into space was Alan Shepard in 1961. And the first woman in space was Valentina Tereshkova, also from the USSR. Now, this we'll all be aware is in 1969 was the Apollo 11 mission, which put the first human on the moon. Now, which was the first space station? It was also developed by the USSR in the year 1971, Salyut 1. Mir was another space station, which is the first consistently inhabited long-term research space station. In 1998 was the construction of the International Space Station, which was the first multinational space station, which included countries such as Russia, USA, the European Space Agency, Japan, and Canada. Now, coming to the Indian part, the Chandrayaan-1 was the first Indian lunar orbiter, and the Mangalyaan in 2014 was the Mars orbiter mission. Now, although the Gaganyaan mission was planned to be executed in 2021, it has been delayed due to various reasons, and right now the tentative date is in 2024. Now, what do we mean by space? Like, where does space start? What is this imaginary line beyond which we say that a person has gone into space? This is called the Kármán line. The Kármán line is at a height of about 100 kilometers from the Earth's surface. Now, why is this particular 100 kilometers the reason for quantifying it as space? Is because beyond 100 kilometers from the Earth's surface, aeronautical flight is not possible using conventional methods. The only way you can fly beyond this altitude is by the use of rocket propulsion techniques. Now, what do we mean when a human goes to space? Do they actually, are they exposed to the environment in space? They are usually present in the space stations that are present in the low Earth orbit. Now, the low Earth orbit is an altitude less than 2000 kilometers, which is less than 1/3 of the radius of the Earth. Now, there are two space stations in the low Earth orbit, which is at an altitude of 400 to 450 kilometers from the surface of the Earth. The International Space Station, which has inhabited humans, astronauts, cosmonauts from October 2000, and the more recent Chinese Tiangong Space Station, which has come into place since June 2022. The humans have not traveled beyond low Earth orbit since the Apollo missions of the 1972. Now, what does space medicine deal with? How the human physiology reacts and adapts to a microgravity environment, and the countermeasures that have been employed by the aerospace medicine specialists while dealing with the issues caused by spaceflight. Now, what do we mean by the microgravity environment? Is it the absence of gravity? We know that the International Space Station, where the ultimately the astronauts or the cosmonauts will inhabit, as Dr. Sarita Dara had already brought out, it has an atmosphere equal to that of the Earth. So why is it that, that they even experience this apparent weightlessness where they float around? The International Space Station is at an altitude where the gravity is 90% of that at the Earth. So a 100 kg man on Earth will still weigh 90 kg at the International Space Station. Then why do they float? It's because they are in a constant state of free fall. Now, why are they in a constant state of free fall? This we'll understand if we understand how an orbit is formed. The orbit, any orbiting object around the Earth is in a constant state of free fall. That is, they are constantly falling towards the Earth. But this, they need to maintain a certain forward velocity, which will pull them away from the Earth, and the gravity, which pulls them towards the Earth. These two opposing forces balance each other out, and hence that orbiting object is in a constant state of free fall. So the occupants of the International Space Station are always in a constant state of free fall, due to which they experience weightlessness. Now, what happens when you are exposed to an environment which is weightless, where there is basically, it is a less demanding environment than that on Earth? For example, if you have seen, if you are conversant with DC Comics, if you are conversant with Superman, Superman ideally comes from a different planet where the force of gravity is much more. That gives him the power that he has when he comes to Earth. Now, the same way, when we travel to an environment where the gravity is lesser, where we feel weightlessness, our body undergoes deconditioning. Deconditioning is similar to that which happens to bedridden patients, where your skeletal muscle mass, your bones are not exactly being utilized to their full extent. So we look at some of the aspects of this deconditioning that takes place on the human body. Now, first is the fluid shift. Due to this weightlessness, there is a fluid shift towards the brain, a cephalad fluid shift. Now, what this causes for a person who stays in the International Space Station over a period of time is a puffy face. That is, their face is enlarged because of the shift of fluid towards the brain, as well as chicken legs, meaning their legs are very thin. Now, what happens is, if you can look at this picture, pre-flight, these numbers designate the mean arterial pressure. So pre-flight, at the level of the heart, the mean arterial pressure is around 100. At the level of the foot, it is around 200 mmHg. Now, in microgravity, because of the absence of any force pulling the blood column down, there is 100 mmHg throughout in the foot, at the level of the heart, and at the level of the head. Now, what happens when they come back to Earth? These people are unable to maintain blood pressure at the level of the brain. This results in what is known as orthostatic intolerance. Now, what are the countermeasures taken in space to prevent this, to counter this fluid shift that happens in space? Are suits known as lower body negative pressure suits. This is lower body negative pressure suits were originally designed by the USSR, where they called it the Chigi's lower body negative pressure suits. These create a suction in the lower limbs, which pull the blood down and helps in maintaining circulation and helps in preventing this fluid shift towards the brain. And also, the astronauts are advised and instructed to take isotonic saline just before re-entry, back when they come back into space, so that they'll be able to withstand the effects of orthostatic intolerance upon re-entry to gravity on Earth. Now, what happens to the bone mass? Now, because of the lack of loading that is felt in weightlessness, there is a loss, there is a huge weight loss, bone loss especially from the weight-bearing bones during space flight. Large amount of calcium and phosphorus is also excreted, which can also result in the formation of kidney stones. The bone mass loss is at the rate of 1 to 1.5% per month. This is 10 times the rate of loss during osteoporosis. Now, what are the countermeasures taken to prevent this bone mass during space? Are weight-bearing exercises. Now, what weight-bearing exercises include resistance training. The normal protocol for training in an international space station is about 2.5 hours per day of aerobic and anaerobic exercises 6 times a week. This enables them, this makes sure that their muscle mass is constant, the muscle and bone mass is constantly being utilized in order to prevent them from being deconditioned. Now, what are the pharmacological methods used to counter this? Bisphosphonates, which are used in the treatment of osteoporosis, have also been found to be useful here. Supplementation with calcium and vitamin D are still being investigated. Now, what happens to our muscle mass? There is considerable muscle atrophy on exposure to weightlessness. This is because, as this picture brings out, on ground in a loading environment, there is equal protein synthesis as well as protein degradation of the skeletal muscle, and there is a conservation of muscle mass. But in space, there is an increased skeletal muscle protein degradation, which results in muscle atrophy. And an important thing to note is that the muscle fibers are of two types. There are slow twitch fibers and there are fast twitch fibers. Studies in space have found that the slow twitch fibers are converted into fast twitch fibers. The slow twitch fibers are used for sustained activity, while the fast twitch fibers are used for sudden bursts of action. Now, how do they counter this loss of muscle mass in space? Is through the use of exercise equipment such as the treadmill and the ergometers. Another very important aspect, and that which has affected almost every astronaut who has been to space, is that of space motion sickness. Now, space motion sickness affects about 50% of the astronauts in the first 24 to 72 hours in space. This causes great operational impairment. And imagine if somebody is doing an extravehicular activity where they wear those big suits that you've seen in movies such as Gravity. And imagine if they have space motion sickness and they vomit inside the suit, which will be catastrophic. Now, NASA has classified the space motion sickness into 3 types: mild, moderate, and severe, based on the severity of symptoms and the duration. Mild is when these are symptoms similar to that of motion sickness, such as nausea, vomiting, and dizziness, which resolves in about 36 to 48 hours. Moderate resolves within about 72 hours, and severe symptoms may persist even beyond 72 hours. Now, why does this motion sickness happen in space? It is because our vestibular system is used to that of the environment on Earth. When it is exposed to microgravity, to weightlessness, there is an alteration in the feedback system. Now, there are various hypotheses to determine why motion sickness happens. Of this, the one which makes most sense is the neural mismatch hypothesis. The neural mismatch hypothesis is that every individual has a neural model, as in we know that through our inputs, through our vision, through our vestibular system, through our proprioceptors, that our body reacts in such a way to such a stimulus. If we are exposed to a stimulus which we have not been exposed to before, our body, our proprioceptors, our vestibular systems get confused, and this results in the symptom of space motion sickness. Now, what are the countermeasures taken to deal with space motion sickness? Of course, training at ground-based microgravity simulators, It is also a common norm that there is no extravehicular activity undertaken in the first 3 days of space flight, and also medications such as promethazine and scopolamine, sometimes with in combination with dextroamphetamine, have been used. And these days, just prior to space travel, people do take prophylactic promethazine. Another important aspect in space is that of exposure to radiation. Now, what are the sources of exposure to radiation exposure? There is the galactic cosmic radiation, there is the solar radiation from the sun, and the geomagnetically trapped radiation. Now, to get an idea of the exposure of radiation that a person in the International Space Station would feel, is they would be exposed to 0.4 to 0.6 millisieverts per day. That if they are on a long duration mission, for example, for 6 months, they would have been exposed to 110 millisieverts. This, when you compare it with the standards that have been set for occupational people who are in occupations where they are exposed to radiation, the standards right now is that one person should not be exposed to more than 30 millisieverts per year. So you can imagine the amount of radiation exposure that a person in space is being exposed to. Another important syndrome that has been found later is this has been especially found in astronauts who have come back from space flight, who have been monitored over the next few years, is space flight associated neuroocular syndrome. Because of the fluid shift towards the brain, there is optic disc edema, and also there is optic nerve sheath distension. And also because of the unloading, because of the weightlessness, there is a reduction in the anteroposterior diameter of the eyeball, and thus near vision is affected, leading to hyperopic vision. Now, coming to some of the microgravity simulators that we have at ground, how can we simulate the effects of microgravity on ground so that we can train the astronauts or expose subjects to the effects of microgravity and collect data and see what happens to the human physiology? There is something called the dry supine immersion, which is the photo on the bottom, which is basically a water-filled tub upon which a person is placed on a sheet, so that he's not is basically in a swimming. It's like being in a swimming pool where you don't feel the effects of gravity. There is also the tilt table testing, which simulates the cephalad fluid shift. There is lower body positive pressure, which again causes cephalad fluid shift. And more interestingly, there is something known as parabolic flight. Now, what is parabolic flight? These parabolic flights are these happen in the photo of the airplane here is that of the 0G aircraft used by NASA to simulate microgravity, and there are similar aircraft is also used in France and other countries such as Canada. So what happens in parabolic flight? Basically, if you can see the photo on the left, the aircraft pitches up 45 degrees and then loses full power, and then for a brief period of time, for 20 seconds, it is in a state of free fall. Now, this state of free fall again simulates microgravity or weightlessness, and this period of 20 seconds is when, as you can see in the picture on the bottom, the subjects inside the aircraft can feel complete weightlessness. And this loop of 20 seconds can be repeated again and again at least 20 times in a single parabolic flight. Now, coming to Gaganyaan. Now, I had spoken to my faculty at the Institute of Aerospace Medicine. They had told me that I cannot talk about the selection process of the Gagannauts, of the candidates who've been selected to go into space, because it is still confidential and has still not been made public. But I can say that the Gagannauts who were selected at the Institute of Aerospace Medicine were from an elite group of test pilots who were obviously with the highest physical standards. But what is interesting to see is that their assessment included probably 40% of physical assessment and 60% of psychological assessment, telling us how important psychology is in determining the people who are tasked with going to space. Now, just while talking about the fact that we selected people from a group of test pilots, the Blue Origin's New Shepard, which is the name of the rocket which took Jeff Bezos and his 3 passengers to space beyond 100 kilometers. The people involved in this space flight were obviously Jeff Bezos, his brother Mark Bezos, Olivier Damon, who has become the youngest person to go to space, and Wally Funk, who's 82 years old, who's the oldest person in space. Now, what this shows us is that in the next few years, it doesn't matter how fit you are. If you can, if you have enough means, you will have an opportunity to go to space. However, this also makes it complicated as well as interesting from an aerospace medicine point of view, as the persons now who will be exposed to such microgravity environments might not be in the best of shape. They might have other disabilities. So and it is not like you can say, we do not say any passenger is unfit to fly. We only look at the pilots. So this will be a new domain which will be exposed to in the near future. Now, finally, I'd like to conclude with a quote from Stephen Hawking. I don't think the human race will survive the next 1,000 years unless we spread into space. There are too many accidents that can befall life on a single planet. But I am an optimist. We'll reach out to the stars. Thank you.
Over to you, Dr. Shalja. Sanjay, you can stop sharing your screen, please.
Once again, I'd like to thank Dr. Vidya for giving us this opportunity and getting us all together here to speak on this favorite topic of ours, that is aviation and aerospace medicine. My thanks also to the participants. I see there has been no significant reduction in those participating, and for the interesting questions that they have asked. One was related to the aviation medicine course. Yes, there is a 2-week course which is being conducted at IIM, and Dr. Sanjay, being a fresh graduate, should be able to share the details of the training officer over there who is conducting this 2-week course in aviation for those medical personnel who are interested. And you can subsequently go on and apply to DGCA so that you can also be enlisted to carry out the pilot medical certification, which is required on a periodic basis for the civil pilots. The second question posted by our audience was regarding the training in disaster management. Yes, I fully agree that this should be inculcated at all levels with the public, starting with schools and colleges and offices, which are environments which are more easy to control. In fact, in the services, we make sure that there's 100% training on CPR and first aid. Even, in fact, the families and children are inducted. I also believe that this has been introduced in the syllabus of students in the schools these days. Further, my special thanks again to Dr. Sarita, who has, combated her circadian rhythm and joined us at that unearthly hour of 3 a.m. as per New Zealand Standard Time. And Sanjay, that was an excellent presentation on space, which is, a relatively unknown territory for most of us. And once again, I'd like to thank you all for, giving us a patient hearing. Thank you, and over to you, Dr. Vidya.
Sarita, would you like to, sum up or just add anything?
No, or maybe just a couple of words to thank everybody who has joined in today, and also to thank you for the opportunity, and also to my fellow panelists. I think coming from IIM, all 3 of us have links to IAM as alumni, and you can see that we've done diverse sort of work over the span of several years, like shailages in the military. My career has gone in a different trajectory, but that was my starting point. So I'd like to acknowledge that, and thank you again for the opportunity. It's early morning here already. It's time for us to start the day, and I really enjoyed being part of it, and thanks once again.
There is a question in the chat box from my anatomist friend. Any histological study done on prolonged stay in the space? There are physiological changes, but what about anatomical changes at the microscopic level? Sanjay, would you like to take that?
So there have been actually numerous studies which have been done, but I would have to get back to you on that. I'll have to look at any research articles related to histological studies. I'm sure there will be, and if I can get your contact, I will get a research article and which is relevant, and probably share it with you, sir.
For the moment, you could just send it to me. I will forward it to him. Sarita, would you like to add anything to that?
Yes, thanks for that question. It's a great question. And I think when we have changes, which, and we do know there are physiological changes in the human body, and there are certain changes which are visible macroscopically, but there are also changes microscopically. And it is an interplay between the various factors that are there in the flight environment, including radiation. And we do know radiation does affect at a cellular level, and there are changes there. So there's plenty of studies in relation to the macroscopic and microscopic changes with respect to space flight, and pretty much long duration space flight, not the short duration ones. The long duration could affect all systems, all the human systems, including the immune system, the hematological system. Everything can potentially be affected. I'm happy to share some of the studies. Maybe the twin studies is something that has done a lot of work at the molecular epigenetic level. So there are only two people. So they are twins. One was on the Earth, the other was in space. And it's a very small N for a study. But over a period of time, they served as a comparator. For the one on the ground was baseline as compared to the one in space, and they were like identical twins, and they actually did analysis on them, the same sort of tests, and they've published that. So maybe I can share that with you, Dr. Vidya, and you might be able to forward that on to Dr. Virendra Kumar.
Thank you. Professor Rajaram has also joined us from the United States, and he's keen that such programs should reach more younger people. Sir, would you like to say something? You're muted, sir.
Thank you, Vidya. I have nothing much to add, excepting that it's a very interesting talk, and it should stimulate the undergraduates and postgraduates and teachers also. So I feel that as we were, even 40, 50 years ago, when we were medical students, we were trained in the disaster management. And today, it's very pity that students are not aware of what disaster means and how to manage. I'm particularly supposing the doctors who are working in remote areas, if they have any problems, how to manage. They cannot depend on the people to come from the cities. So that was my intention. Thank you, Vidya.
Yeah, we have Amit, who tried as best as he could to get Greg Van to join us today, but things turned out otherwise. So Ghosh, would you like to add anything?
Yeah, I mean, it's a wonderful time to be practicing medicine when you get to hear talks like this. And I think Dr. Sarita is well aware of, she's already ready to be in the space where it's timeless. So 3 a.m. there is same as Rochester time of 10:03. But a couple of things I wanted to say where the space medicine is so far ahead is that to send a single person to wherever in the space, you need a teamwork, amazing teamwork, groundwork from all kinds of peoples, engineers, PhDs, doctors, risk-taking behavior, human factor engineering, all of these, none of the things which I've seen endeavors which are done in space is out of context on what we do in the ground. So from the suits that we wear now, from the football dresses they wear, all these clothing have been designed initially for the space, and that has come now to the main league. So hopefully there'll be a lot of translations other than just the telehealth, but the robotic techniques, the robotic arms that we use for surgery, all have been taken from the space. Having said that, there's one thing we are lagging behind is the safety. And as you can see, our patient errors, we are losing in United States 250,000 human beings in a year from medication errors and physician errors and all that. And somebody has calculated that to be 3 fatal aircrafts crashing every day. So the loss from that, which never happens in the space world, but is happening as I speak, somebody's dying of medical errors. So if that were to happen in space, there would be a national level inquiry, all kinds of regulation. We haven't seen that in medicine yet. And that's always the quest to keep doing that. Now you talked about the other thing about Dr. Purushottam mentioned about Jeff Bezos and others. I have not examined him personally, but I am in a position here in the Mayo Clinic where I examine several people of his stature, not the 1, 2, but others. They are in tremendously fit situation. So never underestimate an 82-year-old woman, how fit they are. Because what they have done in their life is they have achieved tremendous wealth, and that has opened up tremendous time for them. So they put in 2.5, 3 hours a day doing all the simulation and exercise that you talked about. They have all kinds of trainers to help them. So it's by no accident that they are not foolish people to go to the outer space and risk their lives. So they are extremely competent. But what we are afraid of is that the space travel should not become like Mount Everest, where Nepal government allows so many people to go. There are crashes and there are all kinds of accidents happening. So that kind of regulation and sensibility ought to occur, which may not once people have a tremendous amount of wealth here. But thanks to the people in this, the 3 of you who have really taken this initiative, it's not something that a person with lightheartedness to take from a person thinking of a career. I don't know financially is it sustainable or is more of an adventure spirit that you go. People still join medical school and engineering school because they think it will be financially viable. So my question is, if somebody in the year 2023 were to listen to this talk and get motivated, is it going to be only for scientific reason or also for economic and other reason that your profession is going to be viable to a lot many people? Or the situation is such at the present moment that maybe you don't need to expand the program that much. In my idea, from whatever you said, the more the merrier, because it's only the start. It's very fascinating, and thank you for all the time. And thanks, Dr. Vidya, for being tireless in our effort to go all over the world to get the best people, unite them in this forum. We have learned so much over the last 2-3 years that this program has been in place.
Dr. Shailja, would you like to take that question? Maybe first you and then Sanjay, who's closer to the people who are likely to want to join.
So we do have a program by IM called the Traveling. Sanjay, can you just help me out with that? What is he called? The Traveling, I think, specialist, where they go to various colleges and interact with the students over there. This is to, bring about the awareness related to this subject and encourage them to join this specialty. Sanjay, do you remember what is that called? The traveling specialist or something like that? I'll share the presentation with you subsequently, but that is a venture by IAM. They are going out to all these colleges.
Sarita, what Ghosh was trying to say is, would this career choice be economically sustainable if a bunch of students decide to take this specialty in the near future?
I can share my journey. So the specialty is highly specialized, and there are very few people who actually are working. So, but there are opportunities in the sense that many people don't just work in the field of aviation medicine, they diversify. And that is the reason why, the reason for my diversification, because if we are only focused on one very, very specialized niche area, then there's you lose the opportunity to explore the breadth of the field. People also work in occupational and environmental medicine alongside aviation medicine because they're complementary. In certain countries, you need to do public health before you can specialize in aviation medicine. So you do your master's in public health as a first degree, and then you specialize in aviation medicine. In some countries, you first specialize in occupational medicine, and you could do aviation medicine as a subspecialty. So there are different levels at which you can do. Some people just do a basic 2 weeks or a 1 week introductory aviation medicine program, which exposes them to the aviation flight environment field, and then they become aviation medical examiners. And that could be also some form of revenue generation, but obviously they would be doing other things. Maybe they would have their own practice doing general practice or some other specialty. So often people come into aviation medicine having done some other specialty. That's what my experience has been, looking over at the spectrum of careers in this field around the world.
So, I may not be in the top 20 percentile, but I like to think I'm somewhere in the middle, and I didn't even know such a course existed. So I'm sure there are loads of people who don't even know that such a course exists. So that was the fallout, though my initial reason to do this session was to just know about aviation medicine. I wanted to spread some awareness about aerospace medicine. But the first thing that came out of that is that I actually knew there is a course, and here is my colleague's son, Sanjay. I work with his dad regularly, and I was so, and when somebody casually mentioned that Sanjay did aviation medicine, that's when I knew that, oh, there's some specialty called the aviation medicine where you can do your MD immediately after MBBS. So thank you, everyone. And Ravi has his hand up, and iPhone, I don't know who you are. Would you like to go first? Your mic is muted.
Was it me? Yeah, I also posted my question there. It's about, all of you have talked about the health of the crew, the people who fly, and the ground staff, etc. But how about certifying sick patients to fly? I think it was Sarita who mentioned that many of us have been called upon to attend to a sick patient, while we are flying. It has happened to me way too many times to count, actually. And I was wondering what, most of the times I wonder who allowed these patients to fly in the first place. So is there any way of, or any pathway to get the right person to do these certifications?
May I answer the question?
Sure.
Try to. Thank you for the question first. So there are airline medical departments who are responsible. So airlines have medical departments and doctors who are employed to actually look after passenger health. That is a very generic thing. So if we have a sick person who needs to go from point A to point B, a certain duration of flight, and they need medical support on board the aircraft, then they can liaise with the specific airline and the medical unit. That's an option that's possible. But I guess the question is also about generally in terms of passengers when we are often called for in-flight emergencies. And those may be relatively well human beings who go on board the aircraft and end up with maybe, let's say, ear pain or tummy ache, or maybe just have a collapse on board the aircraft. Or a very common situation, or and that you have is people, have some sort of anxiety about the flying itself, or if they're experiencing turbulence or something like that. So I guess in those situations, the cabin crew are trained to do some first aid. So there is a basic medical kit on board the aircraft. It is virtually impossible to probably screen every passenger medically and assess their fitness to fly before they board a commercial flight. That is, we don't have the resources to do that. So airlines typically assume that people who are flying are relatively healthy to do so. But despite that, there may be events in flight, in which case the cabin crew are able to manage some of those events. And if there's a specialist physician on board, or if there's a doctor on board, they are called upon to help the cabin crew. There's only limited things that you can do on the aircraft. The medical supplies are limited. So the Aerospace Medical Association has actually published certain guidelines on what can physicians do. I can share that link with Dr. Vidya. There is also an app. You can actually, if you are a physician and you have the app on your phone and you end up with a medical emergency, it actually tells you based on which region in the world you're flying, what you need to do, what kind of supplies will be there with what airline, and how you can approach the problem. So I think I'm happy to share that as well. And that probably is something that is good to have on our phones.
I agree. I agree. Yeah, for the most part, all I've had when people have called on me is a defibrillator, and you wonder how you're going to use it in a child who's having febrile seizures. But that's.
Kavita, you have your hand up. Did you have any other question? Kavita?
Yes. I'm stating this because I travel often to Hyderabad. And too many flights have had emergencies, seizures, MIs. As an internist, I've helped many, many patients. Their kit is very inadequate. It is extremely stressful as a physician to travel, helping patients by their side 6 to 8 hours. So I disagree. It's not a minor problem. It's usually a major, major issue, to a point where last time I told my family, do not let me help. And my 20-year-old son got very angry with me. He said, there's no way there's no ethics, morals. I had an exhausting trip in India with very sick hospitalized kid. And I had so much guilt in me. If something happens, I will be by their side. So all international travelers, even my sister is a physician, we dread flights. I don't know how many times I've had to deal with very serious situations. A person is dehydrated, they have only 500 ml of normal saline. It's not a joke. And the airlines do not even say a thank you. Not even a thank you, forget it. I always travel economy, and it's exhausting after helping someone. We had to land the plane somewhere, get off the patient has gotten off the flight, you're back in your seat. I've had a 15-hour journey become 25 hours because of all the emergencies. So I don't know about this space medicine, how it goes, but similar situations probably will occur because it's an emergency. And I'm not sure whether people will survive because they won't have the medical support and it's stressful. So thanks, I just wanted to make the comment.
Yeah, so actually there is not even a self-declaration, isn't it? During COVID, you have to say that, okay, I don't have COVID or something, but I don't think any airline, especially long flight airlines, even ask you, assuming everybody is being truthful or has a good sense of their health condition, they don't even ask you, do you think you're all right and are you physically okay? Whereas the airlines immediately discriminate against somebody who's disabled, because my husband used to be on a wheelchair, and at the airports people used to pounce to say, no, we want to check his fitness. I said, I mean, he's perfectly fine. It's just that he's on a wheelchair. What's your problem? Whereas somebody with ejection fraction of 15% may be on the flight, and nobody cares. So maybe there's something to think about. People like you who are in positions where you may be able to make change. Maybe it could be one of the advisories to airlines that at least there should be a simple self-declaration form that if somebody has some serious medical illness, so that at least maybe those flights could have some extra supplies or something. I mean, I don't know, but definitely it's something to think about. iPhone, you still have your hand up. Do you have something to say?
If I may just mention that invariably the passenger will not make an honest self-declaration because he is scared of being put off the flight. In fact, though there are restrictions to flying in your late trimester of pregnancy, people obtain false certificates so that they are able to undertake this flying. So yes, it is a complicated situation. If the airlines start insisting on medical certification for each and every passenger, it's not a practical
No,
solution.
when actually a sick person really needs to travel, that time they are put through loops. When they have declared and there is a a doctor accompanying with whatever other things, the airlines make it sometimes quite difficult for a person who actually declares themselves to be ill and needs to go to some other place for treatment or go back home after treatment. But what Kavita said is a common thing. Like all of us have faced. Anyone who goes on long flights has faced this, right? So
okay, so one aspect is traveling as a passenger, and the second aspect is traveling as a patient. Now, a patient will usually have the recommendations of a doctor, which will have that aeromedical management team, and they generally give all recommendations, what kind of monitoring is required. In fact, invariably there will be a medical attendant accompanying such patients, and same thing. So in that they are in a better situation because they will be handled by this aeromedical evacuation team.
yeah, unless somebody has some question or comments, over to you, Radhakrishna.
Actually, a couple of years ago, one of the very senior surgeons flew from Heathrow and had acute retention of urine, it overflowing. Now, I don't know whether a Foley catheter will be available on a flight, and what can happen. Like he came in a very, very sad state actually when I was in a big corporate hospital, and that's interesting. I often wonder what can happen if somebody's bladder is full and there's no urine coming out. That can very well happen, especially during long flights. Anyway, having said that, I think this is a very, very refreshing topic, and a lot of it looked fictional to me rather than facts, and it looks like from DC Comics, and I really envy the speakers because of their association with big flying machines, the big pilots, and flying and all that. I think that must be a very interesting career. And then I think, this is a very refreshing topic on marvelous medicine, and the speaker spoke so well, and I really envy them, because of the depth of their career and the variety of the jobs they do. Back to you, Vidya.
Puneet, you have your hand up.
Yeah. I just wanted to sort of, I was happy that Sarita told me there's an app. Every time I've flown, I've wondered what to do. I thought we should have a course, at least a short, a course where we know what to do when we are faced with that situation. I've sorted out my conscience. I've always got up because I thought, I'm at least better than the cabin crew. Something is better than nothing. And I go and tell them that I'm a surgeon. There's very little I can do without the right tools. But the comment I wanted to make was that, that box which is there is static with some 1940 regulation. I think the people who are here, the movers and shakers here, should get together and re-update it. So I was on a flight in May where direct American Airlines flight from New York back to Delhi where I had not, she said a 15-hour flight actually went on to 72 hours. We were grounded in London. We managed to save the patient. There was a pediatric surgeon who was resuscitating this 80-year-old guy. When I woke up and I, helped, I told her I'm a surgeon, I can't do much. She said, I'm also a surgeon. We both managed to actually resuscitate the patient, but by then the pilot had decided to land in London. Now, problems, one, if that guy, we hadn't resuscitated him, I don't think he would have survived the transfer after landing in London, because they took an hour and a half with the paperwork at the transfer. They didn't get the patient off the flight at all till all that paperwork was complete. So I thought that was ridiculous. There's no way anybody could have survived that golden 1.5 hour, bronze 1.5 hour. Then, 3 months later, so because we'd actually helped, I like, somebody just mentioned that you try to avoid listening to that message when they say there's a doctor on board. But since we'd helped this one, the subsequent flight, I had, going for a surgeon's award function to Ahmedabad. They said there's somebody having a problem. I saw this young guy having a thing, and he couldn't, I thought he can't be having an MI. So they didn't even have an oxygen. We need to change that contents of that. First of all, they're very reluctant to open that box at all, the cabin crew, because they have to go through a whole lot of paperwork after that. But then they said, there's no point opening because we don't have a pulse oximeter. So fortunately, this was a Dehradun to Ahmedabad flight where we had a lot of mountaineers, and somebody got an oximeter because they'd been hiking. And I was very convinced that this 30-something-year kid person couldn't be having a heart attack, but he was convinced he had. And I said it looked like a panic kind of a reaction. So I was trying to allay his anxiety and all that. And this guy I showed him that, by then we gave him a sorbitol. But I showed him that his pulse ox is absolutely okay, so he doesn't need to worry. They are, this was the startup flight, so they upgraded us to a premium economy. And there I started chatting with him. And finally I realized that what he had, as I started talking to him, he was a pharma manufacturer. He actually had claustrophobia. So the moment we got, and I told him that, and when we got off the board, he says, doctor, you're absolutely right. I now remember in the lift also, I had a similar minor attack. So, I mean, with all these, I think we should have a training, maybe mandatory, but at least to start with, optional. I would love to do that because I travel a lot and I love to travel a lot and like to help out if it's possible. So, I think it should be a dynamic process rather than some international airlines organization set in stone in 1940 or whenever it was formed.
Thank you, everyone, for joining. Sanjay, you really held your own amongst the two stalwarts. So congratulations for that. Thank you, Shailaja, for putting this thing together. And I really can't thank Sarita enough for having a sleepless night just to be for 1.5 hours on this program. Today we reached for the stars, and next week we'll be diving to the depths of the sea. So next week's Marvelous Medicine session will be on underwater medicine, and I invite all of you to join that. Please spread the word, and we'll see you again next week at 8 o'clock sharp for the episode of Marvelous Medicine on underwater medicine. Good night. Take care.